Europe's Speaking Cancer Plan is possibly one of the most ambitious and well-funded plans that Europe has ever had. And it is a holistic plan. It goes from prevention to screening, to treatment, to care, to quality of life. This is every European citizen's plan, because what we are trying to do through this plan is to change the realities for cancer care in Europe, so that we have equal access and care for all the citizens of Europe. It's now 4 years where it has been delivering actions with significant changes, but there is still a great more to do. We updated the screening recommendations for breast, cervical and colorectal cancer for all member states after 19 years. We have now are working towards setting up a network of comprehensive cancer centers that will improve equity of care for all European citizens. There are many different actions going from prevention to quality of life afterwards, with the main focus being on ensuring that every European citizen and every European cancer patient, no matter where they live, have equal chances of surviving cancer, equal access to medicines, equal access to optimal treatment and care. One of the biggest challenges that we encountered was because of the pandemic, because of COVID. It impacted a great deal on the access of citizens to screening programs. Member states had to put screening programs on hold because of the pandemic. It impacted on the access to care of cancer patients. That was a challenge that could not be foreseen. This was an unprecedented health crisis. It had never happened before. But we worked very closely with the member states and with the health ministers to ensure that people got back to screening, to ensure that cancer treatments were not interrupted. But it showed you also the need to have the system in place to be able to withstand these types of crises. But yes, it was one of the big challenges was cancer care during the COVID-19 pandemic. Another challenge which we have put a great emphasis on is psychosocial care and mental health of those patients going through cancer and their families. We often don't talk about this. We talk about other treatments for cancer, but we don't look at treating the whole person and not only the disease. And we need to look at mental health issues as well. And that's why we put forward a comprehensive strategy on mental health as part of the European Health Union for the first time. The challenges are always there in the field of cancer care and in health. There are always challenges, but we have a plan that is well funded, that has spreads across a whole range of actions, and which we are implementing step by step. Access to innovative medicines is a huge challenge. What I think is important here is to stress the fundamental principle of equity and access. What we are doing as part of the European Health Union, we've put forward a new pharmaceutical reform proposal, which looks at improving access of medicines for all citizens in the EU, creating a single union of medicines, and also increasing access to innovative medicines. And this will, of course, benefit cancer patients as well. In order to understand what the problems are, you need to be able to identify them. And for the first time, we have created an inequalities register, which is mapping the situation in relation to cancer care, to medicines in all the different member states. The reason for this is that it allows us to focus on where we should be supporting member states in order to bridge the gaps, so that we are able to bring forward the concept of equity in cancer care across the EU. We are building up a network of comprehensive cancer centers to ensure that all cancer patients have access to a comprehensive cancer center. This comprehensive cancer centers will be accredited, and this is the way in which you will bring up equality in access to care of all the patients in the EU. Both patients with rare cancers and pediatric cancer patients, they do face unique challenges. The pharmaceutical reform that we proposed has many proposals in it to do with innovative medicines, which will improve access to innovative medicines for all patient groups, and this includes those with rare diseases and pediatric cancers. Also, the European reference networks we have for adults with rare diseases, and we have the European reference network for pediatric cancers. For the first time, we have linked Europe's Beating Cancer Plan with US Moonshot in order to work on pediatric cancers together and really exchange information. Cancer in childhood, we have a specific focus on it. We've created a youth survivors network to allow everyone to come together on a platform and exchange information, including the young patients themselves. It is very difficult to be diagnosed with cancer. It is even more challenging if you hear that you have a rare cancer. So we have really focused a great deal of the plan and joint actions in addressing the needs of those with rare diseases and children with cancer. Because the European reference networks allows you to pool all the knowledge together. So even if you don't have a large number of patients, a critical mass of patients, you're pooling it all together. So even if you come from a member state, which you're one of the very few, you are part of a big network with the expertise to bring all the knowledge together. The European reference networks address rare diseases, rare cancers being part of them, but also pediatric oncology. No type of discrimination for any patient, and of course for cancer patients, is something that we should leave and not address. Retention of employment and return to work are two very important issues for cancer patients. We have a study which is coming out very shortly on employment after cancer. So this is a very important area that we need to protect. Access to financial services, or the so-called right to be forgotten. This is a discrimination in access to financial services by people who have had lived experience with cancer. We have brought it to the European level, and now 4 years later, whereas we had 5 member states which had regulated this, we now have 13. We are not there yet. We will get to the 27, but any sort of discrimination following a cancer diagnosis needs to be addressed, and Europe's Beating Cancer Plan has a part of this, because we don't only look at care in terms of medical care, but also the quality of life. And those who live after having cancer need to have their quality of life and their rights safeguarded. Success is defined in different ways and by different milestones. I believe that what we would like to see with Europe's Beating Cancer Plan is to deliver on the promises that it has made to citizens, and to ensure that we have equal access to screening programs, to treatment, good quality of life for all those who are diagnosed with cancer. And for anyone who has been diagnosed with cancer, no matter where they are within the European Union, to have the equal chances to survive. Being someone who has a cancer experience definitely changes your outlook. It has always been a part of my life. It's a very much a priority in the work that we do to ensure that we protect the rights of patients. But I would say also that it also determines in the work we do the policies that we promote. And I'm a psychologist by background. I worked in the mental health field, so I'm very aware of the needs of mental health. And I believe that when you go through any life experience, which could be any difficult life experience, you can use this experience to bring about change, to make your personal experience political. Europe's Beating Cancer Plan is very much a priority for this Commission. It has been a priority for President von der Leyen from the very beginning. And it's a plan which is now a pillar of the European Health Union. So we will continue to work in that direction because that's what European citizens expect from us.